How many of you know someone or know of someone that has been pregnant? Now just imagine that person going through pregnancy with no complications, and finally the magical day has come. Labor Day. You're waiting in the waiting room and you're waiting to be able to finally meet the new addition. And finally the doctor comes out and you're expecting to be able to meet the new addition. But instead you're bombarded with the news that the mother has passed away due to complications. Unfortunately, this is the sad reality for many women and their families. Every day, a new life is born into the world, but unfortunately, some mothers are not able to survive childbirth nor pregnancy. In the United States, 23.8 per 100,000 women die from pregnancy complications every year. And surprisingly, women of color are 2 to 6 times more likely than white women to die to these complications. The main cause of maternal deaths are linked to hemorrhages, pregnancy-induced hypertension, embolism, infection, severe bleeding, and cardiomyopathy. Racial disparities within the healthcare system attributes majority of the issues caused during pregnancy, childbirth, and postpartum. Every day in hospital, people come there for different issues. Some go for heart issues, bleeding, or maybe a simple cough. But you never expect childbirth or pregnancy to be the reason for those issues. Hospitals should be more equipped to handle at-risk patients while pregnant and during childbirth to lower maternal death rate. The CDC has discovered that 40.8 out of every 100,000 Black women experience maternal mortality compared to 12.7 out of 100,000 for white women and 11.5 out of every 100,000 Hispanic women. Cardiomyopathy, thrombic pulmonary embolism, hemorrhage, and hypertensive disorders contribute to more pregnancy-related deaths of women of color than white women. Black women are also 3.3 times more likely to experience these issues than white women. This can be avoided with better prenatal care and hospital care to avoid these problems before and during birth. Within the healthcare system, women of color are not afforded the same attentive care, medical care, nor prenatal or postnatal care as other women. Many of the issues caused during childbirth and pregnancy stem from the lack of proper contraceptive care, Medicare, prenatal care, and counseling. In an analysis of California, Black women enrolled into Medicaid were less likely than white or Latino women to be provided with postpartum contraceptives, and when they were less likely to receive highly effective methods. Another disparity is due to lack of health care and training issues because they are not fully attentive to the African American women, according to the Center for American Progress. An example would be when professional tennis player Serena Williams had to force medical professionals to do a CT and ultrasound on her after birth because she was gasping for air. The nurse suggested she was confused because of her pain medication. Later scans showed several blood clots and a hemorrhage at her C-section incision. It shows that the increasingly high maternal mortality rate among women of color and the lack of resources and quality of Medicare is the root of that issue. Maternal mortality is striking upon women of all races during pregnancy and birth, but alarming in comparison to other races of women. Women of color are 2 to 6 times more likely to die to complications than any other woman. The answer to the issue is us. Fight for better insurance for underprivileged people when you vote. Fight for better ethic and professional practice within hospitals, clinics, and more, so that we can lower the terrible maternal mortality rates for all women. Remember, the U.S. is the only developed country with a constant rising PRMR. Our women matter.